This is the right ulna of an adult individual. We have the proximal end here. So this joins or articulates with the humerus to make up the elbow. And then here we have the distal end, which articulates with the bones of the wrist to make up the wrist. And the shaft of the ulna, down in the sort of the distal third, it's kind of circular in cross section, whereas up more towards the proximal end, it has a triangular profile. So if we zoom in to have a look at the proximal end, so one of the most noticeable features that you can see here is this great big sort of curved hook in the most superior portion of the bone. This is called the olecranon process, and this is what sits in the olecranon fossa of the distal humerus when the elbow is in extension. So that's this is from the lateral side of the bone, from the posterior side of the bone, and then the medial side. So down sort of here we have another projection of bone. This is called the coronoid process. And for this one, when the elbow is in flexion, so when you bend your elbow, it's the coronoid process that sits into the coronoid fossa of the distal humerus. So if we look anteriorly, you'll see that the coronoid process is more towards the medial side of the bone, so more towards this side. And that's because on the lateral side, we have this little notch here. And it's almost like a sort of a cutout of the bone. This is the radial notch, and this is where the head of the radius articulates with the ulna. And you can see sort of on the edge here, this is nice subchondral bone, which forms that joint surface. And then the other large feature that we can see at the proximal end of the ulna is this sort of the semicircular area that forms the space between the olecranon process and the coronoid process, and this is called the trochlear notch. And this is the part of the ulna that will swing around the trochlea of the humerus as you flex and extend your elbow. So it's all joint surface, these bits here. And then another feature that we can see on the medial side is this, I suppose it pokes out slightly. It's almost like someone's pinched the bone and pulled it out towards the medial side. So this is a tuberosity, which is sometimes called the tuberosity of the ulna, but it's also called the brachial tuberosity. That's because this is where the brachialis muscle attaches. So that's more towards the medial side of the bone as well, sort of just inferior to the coronoid process. So this can help you side the bone if you only have the proximal end, because you'll have the radial notch on the lateral side, and then the coronoid process and the brachial tuberosity on the medial side. So down towards the distal end of the bone, less going on down here. So we have sort of the abrupt edge of the bone, which is quite rounded. So this is the head of the ulna. And then here on the posterior side of the bone, we have the styloid process. And this is supposed to be on the medial side of the bone, but if we hold it there, so we're looking from the anterior view, well, I suppose it's towards the medial side, but on some individuals, it kind of floats around a little bit. So if you've only got the distal end, it can be a bit awkward to try and side. If we look a bit closer, you'll see that one side of the bone above the styloid process is kind of smooth, whereas on the other side there's a little dip. And this little dip is the groove for the extensor carpi ulnaris. And this is always on the lateral side of the bone. So if you can find the groove, that should be on the lateral side of the styloid process. So that can help you side the bone and orient it as well if you only have the distal end.